statistics has proven that 1 in 8 men from other backgrounds would develop prostate cancer in their lifetime. Hi everyone, welcome back to my YouTube channel and welcome to continue our chat over a cup of tea. I remain Sinat, your favorite prostate specialist, urology nurse practitioner. We discussed shocking statistics on our previous episode and where we talked about risk factors associated with prostate cancer, and we identified Black men as higher risk, with statistics showing that 1 in 4 Black men would have prostate cancer in their lifetime. Whereas men from other backgrounds, statistics has proven that 1 in 8 men from other backgrounds would develop prostate cancer in their lifetime. We also identified risk factors such as family history of prostate cancer, ovarian cancer, or breast cancer as one of the key risk factors. So if you are yet to catch up from the last episode, you can still go back and watch the full episode. It's showing on the channel. Thank you. So after the previous episode, I got various comments. I was really impressed, and I want to thank everyone that took their time to watch the video. So I got various messages from people concerned about their loved ones. Men sent me messages, people concerned about their father, their brother, their uncle. And one common word I got from there is that men feel less of themselves discussing about their prostate problems. Why? Do you think men should feel less of themselves discussing their prostate problems? In my opinion, I would say men should not feel less of themselves discussing the major organ that plays an important role in both reproduction and urination. So let's go now and discuss our topic for today's episode. And what is PSA? Why is everyone shouting PSA? PSA is known as Prostate-Specific Antigen, and it's a protein produced by the prostate gland. And this can only be measured from taking a simple blood test, which you just need to book an appointment with your doctor to get this sorted. What is prostate? The prostate gland is usually the size of a walnut, and the prostate gland is the only gland that grows bigger as men grow older. Now, I think you would be curious about why this gland is causing so much problem. Where is it even located? Why is so much importance attributed to this gland? Let's go through that. The prostate gland sits underneath the bladder and surrounds the urethra. You would be wondering, now she's all saying medical jargon. What is she saying? I'm going to break it down. So the bladder is like a bag. It's a bag or balloon because it's elastic in nature, and it holds urine, and that's urine produced by the kidney. The urine is usually carried by the urethra from the kidney into the bladder. So the urethra is a tube. It's like a pipe. It's a tube that carries urine from the bladder, and it goes through the prostate. So by the side of the prostate, we've got nerve endings that help in maintaining erection and sexual stimulation. Also, both sides of the prostate houses the seminal vesicles. And what does the seminal vesicle do? They produce semen, which is the fluid that carries sperm. So we've talked about various associations now with the prostate. So you now understand why the prostate gland is a naughty boy and why he is causing so much problem, because it's got association with various other organs as well. The urethra that carries urine out of the body passes through the prostate. And the seminal vesicles that produce semen, which is the fluid that carries sperm, is just by the sides of the prostate. The balloon that holds the urine produced by the kidney is above the prostate. And the nerve endings that controls erection and sexual stimulation run along both sides of the prostate. So it got a lot of function associated with it. The average size of a normal prostate is about 20 to 30 grams, and this tends to start increasing after 40. That's why PSA values and ranges are quite proportional depending on the size of your prostate. I call the prostate gland the men's fingerprints. So if you're asked by your doctor why you want to get your PSA level checked, tell your doctor, because I'm a man from Black heritage. And I know as men from Black heritage, we have higher risk. And that's why I want to start my PSA screening soon. Mention to your doctor if you have a first line male relative who has previously suffered from prostate cancer. That's either your father, your brother, your uncle, your grandfather. It is important to also mention if you have any of your female relatives who had previous history of breast cancer or ovarian cancer. The BRCA gene can increase prostate cancer risk. Symptoms check. Even if they might seem very minor, but please tell your doctor if you experience any of the following symptoms: frequent urination, especially at night, a weak or interrupted urine flow, pain or blood during urination, erectile dysfunction, blood in the semen. Don't just go to the doctor. Visit with a plan. Now you have a blood test done. What is the next step? Wait for the results. Then you ask, how long does it take for the result to come back? It depends on the part of the world you are watching me from or you live in and where you're getting your blood test done. Where the part of the world I live in, and I'm talking from at the moment, is the United Kingdom. And within 24 to 48 hours, your blood test result should be ready. And now the blood test is ready. How is it interpreted? There are age-specific thresholds set for people according to the NICE Guidelines 2021, which is what we use where I live, where I work and practice. And this is the guideline. So we have specific thresholds set for people within age groups. However, if you've got an enlarged prostate, your own PSA threshold could be higher than this in comparison to the size of your prostate. But this just gives you a rough idea of what to expect. You can screenshot this just for you to have an idea of what the normal ranges should be like. So we'll talk about the threshold. Age less than 40, we use clinical judgment to get the normal threshold. Then age between 40 to 49, not greater than 2.5. Age between 50 to 59, not greater than 3.5. And age between 60 to 69, not greater than 4.5. These are the normal ranges for PSA levels of this age I'm just mentioning. Age between 76 to 79, not greater than 6.5. And age 79 and above, not greater than 10. If your PSA is above this specific age threshold, don't panic. Remember, it's just a protein measurement from your blood. And this protein is produced by the prostate gland. It's not a death sentence. It doesn't automatically mean you have prostate cancer. Remember the analogy. The bigger the prostate, the more protein produced and the higher the PSA. So there are three things that can cause the PSA to be raised. One, inflammation, that is infection. Then two, benign prostate hyperplasia. That's called BPH. I know everyone hears that almost every other day. Oh, he has BPH, he has BPH. That's just a growth that is not cancerous. It's just a growth within the prostate gland, which is not cancerous. And another thing could be prostate cancer. So do you want to know the next action? Now you've done the blood test, you know what the normal ranges are. Then join us on our next episode. Follow, like, and share. If you have 4 black men in your group chat, send this to them right now and share the love in your community. The risk checker link from the Prostate Cancer UK website and a barcode for you to check, for you to get a checklist to prepare you for the test is attached to the end of this video. I remain your favorite educative urology nurse practitioner. See you on the next episode of our Tea Talk Time. Cheers! Bye!